1, 2, 3.
The following is a Laura Flanders Show audio exclusive.
Is the Supreme Court decision in Dobbs versus Jackson Women's Health a death sentence for women of color? The overturning of Roe versus Wade not only creates a new abortion disaster for millions of Americans, it also exacerbates a maternal health care crisis that was already deadly for many. Unique in the industrialized world, Americans are 14 times more likely to die by carrying a pregnancy to term than they are by having an abortion. It's a surprising fact to many people, and it even surprised our guest when in 2017 she set out to write about Black women's experiences in pregnancy. At a time when even she thought that American women hardly ever died in labor anymore, Linda Villarosa found out quite the opposite. And if they were African American, those women were 3 times more likely to die than white women, regardless of their health, their education, or their economic status. It's a reality that justices overturning Roe ignored, with a history that many in this country would prefer we didn't teach. But as Villarosa discovered, the way we treat Black women is deadly for millions of them and unhealthy for society as a whole. So what is their future now, and all of ours, now that more women will be forced to carry more babies to term against their will? Linda Villarosa's new book is Under the Skin, the hidden toll of racism on American lives and on the health of our nation. She's also a professor at the City University of New York with a joint appointment at City College.
I am so happy to welcome you back to the show. And I'm going to start with that question that we sometimes just kind of throw out there, but in these moments, I really mean it. How are you?
I'm good. I am good. I'm going to say that I was in Aspen, and I'm from Colorado, when the decision went down, the end of Roe v. Wade, and I didn't have cell service. So then I turned on my phone. I'd been hiking, and then the whole thing blew up. And I just, because of training as a journalist, knew what to do: research, quickly figure out what are the talking points, what do I need to say, what do I need to think. And but it was really startling.
I mean, you were there on the middle of your book tour, or maybe you were taking a hike, but your book had just been released. I try to get us to center ourselves in these conversations by asking you, is there a person that sprang to your mind at that moment? Is there a person that you're thinking about now as we speak?
I actually thought back to my grandmother. So my grandmother came from Mississippi, which is ironic, I guess, because of where the decision happened and where the problem is worse. In the Great Migration. And she had my mother and my uncle. And then my grandfather left the family for a little bit of time to make money someplace else. But she had gotten pregnant, and she had an illegal abortion. So I thought immediately to her, and I thought what she had to go through, the pain. My mother shared that story with me a number of years ago. And I just really felt for her and felt for the reverberations of her family, the hard choice she made in the 1940s, and the pain she must have gone through.
Now, I read somewhere in the discussion of all of this that prior to 1973, to the decision in Roe versus Wade, women of colors, the number one source of death for Black women was sepsis related to abortion. Is that right?
I didn't know that, but I'm not surprised.
Talk about what the condition was for women like your grandmother at that moment, because we often say Roe didn't go far enough. It didn't bring reproductive justice as it was required. It didn't bring what Black feminists were looking for, but it did bring something.
It definitely brought something, because before that, you can understand, especially at that time period, there was so much inequality and so much racial discrimination that even to get into the healthcare system in any kind of equitable way was difficult. So that's step one. To be able to afford whatever illegal procedure you were getting was difficult. For my grandmother, it was post depression. And there was so much income inequality at the time. My grandparents were, we were fortunate. My grandfather owned a building in Chicago. However, he couldn't get a mortgage for that building because of institutional racism. So he was always, when he came back to the family, he was always freaked out that he would lose his building. So I think of all the financial uncertainty, the healthcare uncertainty, and even my grandmother's desperate decision not to fall into complete poverty. And I think that is really scary.
So fast forward to today. Am I right in thinking that, of course, the lack of abortion access is now at point critical for millions of people that perhaps it wasn't so critical for until this moment? It's been critical for a long time for a lot of women in this country, disproportionately women of color, women of low income, women in states and communities that had made abortion almost unobtainable. But this question of maternal healthcare and childbirth and the dangers associated with that are strikingly not yet in the conversation. Can you just talk? They're certainly not in the Supreme Court decision. Can you talk about what you discovered as you started to look into that situation, that part of this equation?
Well, I was very surprised, as you said, to learn that maternal mortality was still a problem in the US, the death or near death of a pregnant person and a birthing person. And I was shocked that in our wealthy country where we have such good healthcare and such good health technology, that this was still a problem. And also, I didn't understand at the time that Black women were 3 to 4 times more likely to die or almost die. But also, here's what struck me, that a Black woman with a master's degree or more was more likely to die than a white woman with an 8th grade education. And when I heard that statistic, that's what made me start to think critically about this and to say, well, this is not an issue just of having great healthcare. And what I learned was something happens to Black people's bodies or anyone who is discriminated against and treated badly that harms the body and makes you more susceptible, women in this case, to a problem during pregnancy and healthcare. Then when you enter the system, you also don't get equitable care. And there's so much evidence around this. And then when I was writing my story, I got, the best piece of evidence, sad as it was, is the case of Serena Williams. That even though she knew her body extremely well, she understood the condition that she had long time suffered. She spoke up and she had money and healthcare insurance and everything else, but she still didn't get the care she deserved. So at that point, I became very interested in this topic and the connection between this decision. If we think of the end of Roe v. Wade as the end of abortion only, that is way too limited. It's a thing that reproductive justice activists and advocates have been talking about for decades to say, please, abortion is not a single issue. Abortion is a constellation of, and having no access to abortion is about reproduction and even healthcare at this point broadly and not narrowly.
I mean, the 13th Amendment was supposed to bar forced labor. It looks to me as if that's what this decision is bringing back into our lives, forced labor, and specifically forced labor for women of color, or disproportionately so.
It's, the way I like to think about it is when you ask me the things that I was reading and what I was thinking about Sister Song, the Women of Color Reproductive Justice Organization. And I thought, I understand this. I understand that this is an issue. Loretta Ross, I sat at that woman's knee, the founder, and she explained it to me. And I made her do it slowly so that I could get it because I wanted, give me the long version and I'll come up with the short version. And the short version is we have the right as people in this country to choose to have children. We also have the right to choose not to have children. And then if we make the choice to have a child, we have the right to raise that child in a safe, healthy environment. And that's what doesn't happen in this discussion of abortion. It turns into just I have the right not to have a child. But the rest of it matters, and it matters more to Black women, which is why the reproductive justice movement is a Black-led movement.
Now, it matters more to Black women because of that question of the right to raise or have a child in a safe, healthy environment. Do we have a safe, healthy environment in this country for women of color?
Oh, definitely not. And so that's why we have to push not just to get the right, the right of abortion, but to look at the other parts of it. Because in this country, Black women and other people of color, Black people and other people of color are more likely to live in a community that has been stripped of wealth. And when a community is stripped of wealth, it also lowers the health status, period, for a number of reasons, even separate from the healthcare facilities that are there. It means that the air isn't healthy, the water's not safe, it's unclean, environment. You can't get affordable food, you don't feel safe to exercise. And then on top of that, the healthcare system is not as good as in wealthier, more white communities.
And then there's the plain old treatment that women get. I mean, you have story after story in the book, but the one that appeared that was central, along with Serena Williams, to your 2018 article in the New York Times Magazine is the story of Simone Landrum. And I know you've told the story a lot, but just one more time. You were there in the room, and what did you see?
I had basically finished my story. And Simone, I got the feeling she wanted me to come back for her birth. So I did, thinking that I would just put a nice, finish it with this story of this baby being born. And that's not what happened. We went to the doctor, I think it was on a Monday, to have the last test. And the baby was a little bit slow, we were worried about the progression. And he was not good inside. And it was clear from all the machines. So I immediately was scared and called the doula to come. I think she's going into labor. When we got there, I was surprised by how badly they treated Simone. The first thing that they said to her, they kept asking the same question over and over. How many times have you been pregnant? And she said, I have 2 children, but I had a miscarriage. And that miscarriage wasn't really a miscarriage, it was a stillbirth. And the baby died, and Simone almost died the year before. And they kept calling that episode the demise. So to hear the baby that she named, that she loved, a demise, was triggering for her. Then she went to go get an epidural, and they didn't let Latona and I in the room. And so she came back really agitated because they had treated her badly and said things, where are your babies going to sleep? Why do you have so many children? They had said things to her like that. Then finally, when it was time for her to deliver the baby, this doctor came in, and I'm looking at him, I was like, who is that? Because we had met her doctor. It was a younger woman. And then if she wasn't there, it was supposed to be her husband. So at first I thought, well, maybe her husband's kind of old and not so nice. But this was a stranger. And Black women are more likely to have their babies delivered by a physician that they meet for the first time during the delivery. And this was the case with this man. And then he left the room to change his gown without really introducing himself. And then the residents and interns delivered the baby, but they were saying things like, hey, it's your turn to catch the baby. Why don't you deliver the baby? Which was unkind because Simone had had a hard time before. So she should have gotten extra care, treatment, and attention. What I did notice, the 2 good things were Latona, the doula, was there. She was the only person who was not looking at the machines. She was looking at Simone, coaching her through, being kind, holding her hand, talking to her. And then also Kingston ended up born. He's fine. I saw him yesterday, coincidentally. He's 4 years old. He still recognizes my voice because I spent so much time with her. And then even after I went back to visit, and he's doing well, but no one should have gotten that kind of treatment. It was just wrong.
Now, that article came out in 2018, and it caused a lot of attention and a lot of waves. Has much changed?
I think it has changed. I see where one of the best things that happened to me was I got invited to Old Dominion University in Virginia, because after reading the story, they allowed their nurses to, as community service, to become doulas. And so I went to the first graduation of those who chose doulas as their community service. I know Medicaid now in some states covers doulas. And I think that some of the legislation that happened is as a result of some of the work I did, putting in anti-racism or anti-bias training into the legislation. Much of it hasn't passed, but it's still there. So now I think there's a more explicit understanding that racism, and discrimination is part of this equation, and it can't be solved by just having better technology.
So you've talked a little bit about segregated communities and where people live makes a difference. You've talked a little bit about the attitudes of those around them, the healthcare providers, and their understanding of where a African American person coming onto their into labor is coming from. But you're not in your book just talking about people's attitudes. You're talking about systems and systems that are deeply rooted. And I think of the quote that you have in the book from W.E. Du Bois, who says, Black human suffering is viewed with indifference in this country. And I just want you to dwell on that for a little bit, because it seems to be that was a kind of requirement of slavery, of course, and it's still with us, and it's deeply in that Dobbs decision.
It was interesting. I was talking about mental health today, just earlier with students from Howard University, and we were talking about what happens to you when you're a Black person or another person of color into the system, and you're showing signs of a mental illness. You're not treated with the same kind of care, treatment, kindness. You're treated with policing and punishment, and as though you're dangerous. And that has a direct through line to slavery, where we were dangerous, we're scary, we're someone who will harm you. And then that through line keeps going through. You can see it all the way through what happened with George Floyd. You see it today, and not just with mental illness. You see Black people, even when speaking up, being treated as though we're doing something harmful, scary, or dangerous. So I think that just that alone, that kind of idea that anger is danger and needs to be policed, is still in the system. And that is not just, doesn't have to, it's beyond healthcare, it's in all the systems and all the institutions of our country.
And I think the white part of that is people like me were taught not to pay attention to Black pain. Because heaven knows, if we had paid attention, if white people had paid attention or taken seriously Black pain, what would slavery have been to us?
That was through line that is, that's what I wrote about in the 1619 Project. I chose that, the idea that scientists and doctors during the 250 years of slavery used extreme means to prove that Black people had a high tolerance to pain, including emotional pain. So using medical journals, using false evidence, using medical conferences, so that it became institutionalized in the medical system that Black people could endure high amounts of pain to justify enslavement, including emotional pain, to taking away children, beating people in front of you, killing your family members. Then the through line to today is in that piece, I cited a 2016 study from the University of Virginia that found that in a study of 220 white medical students, at least something like 40% of them believed at least one myth about Black bodies, including the idea that we could tolerate pain. And it was interesting because a few days ago, I got a letter from a gentleman whose son was in that study. So his son was a medical student who was in that. And he said, that's really not fair. You should stop talking about that. It really hurt my son's feelings. He felt like he'd been played. The questions were unfair. And for one nanosecond, I felt some compassion. And I thought, oh, his dad is writing him. Now he's a doctor. And I thought, well, you know what? Good, because now he will never have that kind of feeling when he's practicing on a person of color. He will remember not to let those myths cloud his judgment.
And how does that failure or indifference with which we view Black suffering in this country bring us to this situation at the Supreme Court?
It just means that, it's so complicated because first, Black women are more likely to need an abortion, and because of lack of access to contraception. And so there we are in the system that is saying what you're doing is wrong. You're killing your children. And so that alone, to say that to someone when they're going through the pain of an abortion, which is significant, is cruel and it's wrong. But then also to force people to have a child that they are saying, I can't afford to have a child now. This isn't good for my life right now. And you know what? It hit me as I was at that at a conference last week, and a woman came up to me, and she's a healthcare provider of some sort. And she said, Black woman, she said, I had an abortion 10 years ago, which allowed me to get my education. But she started crying because she felt so bad about making that choice and making that decision because of the way we're treated as though we're doing something wrong. But then bringing a child into the world that nobody, that the people who are against choice don't care about. If they cared about it, then they would, Mississippi wouldn't be the poorest state in the country, because that you just took away this reproductive health, facility. You've stripped people of their rights, and also you don't allow them to raise a child in a safe, healthy environment. And it also has one of the highest rates of maternal mortality and infant mortality. So forcing people to have children in a place that is already suffering is unfair. And it speaks to the idea that I don't see your pain. I don't see your feelings. I'm not compassionate to you.
So if we did see everybody's pain the same, or if we had just some empathy muscle that was stronger than racism, and we looked at a situation, I'm looking at a statistic here. In Mississippi, we're looking at a situation where Black women are more likely to die 118 times more likely to die by carrying a pregnancy to term than by having an abortion. If we had real empathy and we saw that statistic, presumably we would be even more alarmed by the decision that has happened, the Dobbs decision that is basically sentencing Black women, many of them under these conditions, carrying a forced pregnancy to term, to death. How can we turn this around if it's that deep? And do you see examples right now emerging where people are saying, okay, we get this, we have got to change this, and not just by creating a window of possibility for a handful of privileged people, but for the least privileged, because only that way will we lift the floor for everybody.
I think there's a couple of examples, and they're kind of medical and a little specific, but I want to give you two. One is there really is a new generation of medical students, whether they're studying to be doctors, nurses, health policy people, they're studying public health, who really want to do things differently. And I really try to lift them up, because a lot of times it's the energy is not coming from the medical schools where they're getting their training. It's coming from the students who were politicized in high school and undergraduate college to be more empathetic, to say, I want to be a different kind of healthcare provider, to demand a different kind of education that is not riddled with old antebellum myths. And I like that. And I've been talking to more and more of them, and I really feel moved by their passion and their activism. So that brings a different kind of, people who are in the healthcare system saying, I don't want this. I think the second thing is really in Louisiana, where I was with Simone and what happened to her in the hospital. That hospital had a kind of reckoning after I left. And what they did is they brought a restorative justice lens to some of their practices. They brought in this woman who had been treated at their hospital. She was about 24 weeks pregnant. So that means the lungs are barely formed, and it's really a crisis stage. Most babies don't survive at that early age. So she kept going to the hospital saying, I think I'm going into labor. And they're like, no, you're not. They sent her back 3 times. And young Black woman. Finally, she was in a crisis, had to go to the emergency room, delivered her baby whose lungs were barely formed. The baby went into the NICU. The baby's like 2 or 3 years old now.
Neonatal intensive care unit.
Yes, thank you. And so the baby is disabled. So the mother went to the hospital during Zoom. It was like a year ago, and told the people in the hospital, the doctors, the nurses, and some of the people who had cared for her were in the room. And she told them what happened. And she was in despair, telling that story. And she forced them to hear her. I don't love that she had to be re-traumatized telling that story again. But what happened after was that hospital ended up they hired 4 people to be in a kind of obstetric emergency room, separate facility. And I was really impressed that they listened to the story. They heard her, they realized that they had done harm, and they made a change in their system. So I think that kind of thing, some of the, when you're thinking about reproductive justice, they say, listen to Black women or listen to mothers. And I think this was a case where listening to someone actually worked. It didn't help her baby, but it did change that system. And I think those kinds of things that are creative, that are smart, that are following sort of restorative justice movements and patterns are really good.
Talk about Asta Roba, who you met in rural Ethiopia.
Oh, she was one of my favorite people, a community health worker. And community health and worker were just three separate words for me. And I went to her village and with an interpreter, and I just followed her around for the day. And I saw this wonderful caregiver who was chosen while in high school to be two young women were chosen to go get educated in what was essentially nursing school, and then brought back to this village to be the healthcare provider and to provide a lot of different kinds of healthcare, everything from vaccinations, mosquito nets, prenatal care, HIV/AIDS prevention, and also have community meetings with the people in the community to talk. And it was like old cranky men and, all kinds of people. And Asta Roba was leading the conversation. And then she took me to the house of this one woman who she was giving prenatal care to. And there were little girls there. They looked up to her and they said, they were saying, we want to be like you. And one of the reasons she got chosen was because she could read and write. So that was an incentive for other people and children, especially in the community, to go to school and to finish their school, and for parents to encourage that. And I just thought, oh my God, I love that moment of the role modeling, really struck my heart.
So what do you think is the path to health equity here in the U.S.?
I think the main thing is to admit that we have a problem. I sometimes get pushback from people who start to, talk about technology and we just need more innovative medicine. And I said, I think we need more care. We need to think about the word care that's in healthcare and think of how to show compassion to people. People are suffering, and this goes beyond race. I mean, you talk to a number of people, no matter who they are, and they're saying, well, I had such a bad time in the healthcare system. I was like, well, yeah, our healthcare system is rushed. It relies too much on technology. It's capitalist, so it's about making money. And that is a healthcare system that doesn't work. But it works less well for anyone from any kind of marginalized community. And we know the most about Black people because we have been in this system for so long, and it's been unequal and unfair for centuries.
So if we could go back in time to the 1970s, but maybe we don't have to because we're back there again, there were Black women, especially Black feminists, laying out a reproductive justice approach that included abortion rights, but didn't stop there. Can you talk about how we might have done this differently, what the Black feminist demand was then and what is it now?
So the Black feminist demand hasn't changed. It's the same. It's those three elements: the right to have a child, the right not to have a child, and the right to, if you choose to have a child, to have safe, healthy environment. So if we had stuck by that, instead of going straight for the, reproductive rights turns into the right to have an abortion, things would be different. I'm thinking specific of the 70s because of the Relf sisters who I wrote about. The Relf sisters were in Montgomery, Alabama. They were 12 and 14, and they were sterilized against without the express consent of their parents. The parents didn't know how to read or write, so they signed an X thinking their daughters were going to get immunizations. So they are sterile. They're in their 60s now, and they didn't have the choice to have a baby and this was done through the auspices of the federal government. So that's the right to have a child. The right not to have a child is simply the right to end a pregnancy if that's your choice. And then also I think of the environmental justice movement, another Black-led movement. that, still struggling today. And that is the right to live in an environment, in a community that is not polluted, that is not polluted by air pollution, by, toxic waste dumps, where Black folks are 75% more likely to live near a polluting facility. And what happened is when COVID first came in 2020, when the pandemic began, it was clear that all of these things were coming to the foreground, including the idea that we live in unhealthy communities. Now, remember that there was that little sprinkling. It was just starting to say, oh, Black people are more likely to be hospitalized / die because it's something you're doing wrong, you're eating wrong, you have all these underlying conditions, or because of some genetic problem. And I was like, I cannot believe that tired old genetic thing is coming up. But then I remember in April 2020, I felt really relieved because the T.H. Chan's Harvard School of Public Health came out with a study that said people that live near polluting facilities are more likely to have a bad reaction to COVID, period, because of the bad air. And, I know that I am a little bit a drumbeat on stop blaming people who are suffering for their suffering, and look at these larger issues. So as soon as that study came out, believe me, I grabbed onto it. I talked to the researchers. I put it in an article because I wanted to say, look, people did not choose to live in Cancer Alley, but look at that area in Louisiana around Cancer Alley. Look, people have high rates of asthma, they have high rates of cancer, and they have high rates of COVID.
I want to keep the themes of your book front and center. And your book is an important and must read for everybody. I also am so living in this moment of what is happening as we speak that I need you to come back to that question again of where we are. And is this Dobbs decision a death sentence for women of color in this country? And if so, what do we do about that?
I've been thinking a lot about this, and I think about, the death sentence, and it's real. There is going to be already, this is hitting the South. I mean, the decision was about the South. It's hitting the South. If you take an overlay of, where the trigger laws go right into effect, or where reproductive health is going to be in crisis the most, you can just see the states of the South where Black people are more likely to live. So I would say, yes, this is a death sentence for some people. And it's the people who can't afford to travel to another state, who are afraid to find the kind of underground DIY situation that will be existing in these places and that isn't always safe. I would say what I'm doing personally is I go right on that Sister Song website and I say, what do I need to learn here? I go right on In Our Own Voices is another RJ organization, reproductive justice organization, that is talking about the things to do. I think we really have to support people like midwives. We have to support doctors who want to do abortions and are afraid. We have to fight it in all ways. And I think what happens is we start to look only for legal remedies. So that's why when I say, listen to Black women and think about what we're doing, legal remedies and working inside institutions hasn't worked for us for so long that there is no, there's no feeling that, oh my God, the system has failed us. The system has failed us for centuries. So we're not thinking about that. We're thinking, what do we need to do to help people get the care that they need? I was having a visit yesterday with a friend and her children, and I'm no blood relation to them. And the woman, I was signing a form so I could go into the room with the children. And she said, who are you? I said, I'm like an aunt. And then she said, oh, you're kin. That's kinship. And I think a lot about that word kinship. And I think we have to think about community-centered remedies while the lawyers do their thing. Good, yay. But for me, I'm not involved with that. I'm involved with who needs me. How do we care for that person? How do we use our networks and figure out the care for the people we love? And not just abortions, but other kind of, reproductive health issues. And that's what I'm doing, and lifting up the people who are doing it, because it's a scary time when they can be prosecuted or fined for just doing the work that they were trained to do.
I love that word kinship. Does being a lesbian change our understanding of kinship or affect how you approach this subject?
I think being a lesbian and being in the queer community has really, being also, having gone through the worst years of HIV and having to, I'm a journalist, so I wasn't really in ACT UP. I wasn't doing that kind of thing because we could get in trouble when I was working at the New York Times newspaper. But what I was doing was volunteering at, HIV/AIDS community service organizations. And that was really moving for me and important. And, I believe in that. I believe in having extended family, and family is, the people that around you who you love and care about. And I think the lesbian community is like brilliant and epic in that. We have other problems, but we do have this circle of people who we care about, who we take care of. And, it reverberates, our circles connect. And I feel the same way as a Black person. And so I feel, I remember when my mother was mad at me about being a lesbian. We had these kinds of conversations, and because she was worried, it's like, oh my God, your life is going to end. There's going to be so much discrimination. And I said, well, actually, there is support and a kind of community and kinship that we have, that how we care for each other. And I think that was one of the things she really heard when I was talking about that.
So maybe if 73 Roe versus Wade was decided on the grounds of privacy rights, I'm hearing everything that you say is about sort of deprivatizing this situation, both the blame and the responsibility and just the reaction to the situation that we're in. I want to end by asking you the question that I ask lots of people at the end of this program, which is, what do you think is the story the future will tell of this moment, of now?
I think that the story is twofold. It'll be about the divisiveness. I think, I grew up in an all-white community, and it's a definite red area. I'm going back to my high school reunion. Everyone is, including my sisters, like, do not go. Don't go into that hornet's nest. But I'm definitely going because I want to hear. I don't want to be part of, I like my bubble, but I don't want to only be in that because things are so divided. And I want to hear. I want to not hear. I want to feel what is going on with other people. So I can, I'm never going to be different, think differently, but I wonder if I'll feel differently as I'll have a kind of open-heartedness rather than to have a kind of siloed situation, given my background. And I think that it's also a time when we look back, I hope that it shows that we pulled together. It showed that we as a community, I'm talking about the people in our bubble, were creative. We tried to figure out ways. We tried to talk to each other. One of the most interesting things my family did was have this intergenerational discussion with my mother. So my mother's it was her 90th birthday. We were upstate, and my children, who are in their 20s, were there, and me and my partner were there. So we said, let's have a conversation about politics and what's going on in the world. So the children were like, we're abolitionists. We just want to blow up the system. Abolition. My mother was like, all you got to do is vote. And so then we have to vote. You have to vote. Did you vote? And then Jana and I were kind of in the middle, but we had this really interesting, raucous conversation. And I think everybody moved to a different place, or everyone's mind open. And I thought we should do that more often. And now that the children are very interested in what my mother thinks about things. And my mother is often interested in what the children think. And I'm interested in both ends. I think that is important, that we keep, talking, sharing our experiences, and figuring out creative ways to do things differently, especially during this crisis time.
What's at stake in this moment? And what is at stake perhaps for you right now?
I think what's at stake at the moment is a real crisis, a real pain, real harm to people who have the least resources. And so people who are living in those southern states where everything's been stripped away, where doctors don't want to practice anymore, where it's already poor, where the system is already crumbling, those are the people who have the most at stake. If you live in a rural area, even if you live in a city without good transportation, like Jackson, Mississippi, where I spent so much time, you're in trouble. And it is a life or death crisis. For me personally, I think my responsibility is to understand the issue, to be able to talk about it, to be able to communicate it, to be, I'm probably not the one that's going to be chaining myself to something, but I am the one who is trying to get a grasp of this, to understand it. I have long been attacked, mostly by medical people who don't believe in the evidence that I present around racial health disparities and health inequality. I'm assuming that will just grow. But at this point, I'm used to it, and I've figured out a way to speak about it, and also to fight back.
Linda Villarosa is the author of Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation. It is out now, and I urge you to take a look at it. Linda, thank you so much for joining us. It's been great talking with you. I could keep going for ages.
Thank you. I love talking to you. I hope to see you in person soon.